successful the Stark Area Regional Transit to get some public transit pilot money, federal and state, that's helping to sort of provide some opportunities, and folks that don't have any transportation need help. This is becoming an opportunity. We're trying to now develop that into a little more user-friendly system. Because right now you have to schedule your rides several days ahead, and there's times when that doesn't really work out. But we are up and running, and we're in the hunt for another round of funding that will help us pilot and extend. So we're hoping that that's an adjunct to the needs for senior citizens in our county that help to them and others.
Great. Look forward to hearing about that in the future. Great. Anybody else from Wayne County have anything they want to add? You want me to circle back to Portage, Courtney? Anybody from Portage County? Okay, very good. So having all the county reports and all the minutes approved, I'm going to turn the podium over to Matt Reed.
Good afternoon, everybody. All right. Today, for our advocacy, let me turn this over. Today, for our advocacy update, I have good news to share, which is not always the case when I get up and talk to you about what's going on at the federal, state, and local levels as it relates to policy impact. And I'm not going to take a lot of time today because we have some fantastic guest speakers here today. So I want to give them ample time to present on what's going on in the counties, and then leave some time for questions and discussions at the end. But I did want to let you know that we had a good budget cycle here in Ohio for older adults. There were wins that I wanted to share with you that we had talked about previously. If you remember at our previous meeting, we talked about what our Association of Area Agencies on Aging was really hoping to get out of the budget. We put our priorities together, and we had a lot of successes, starting here with $40 million going to all 88 counties of American Rescue Plan Act funds. Those, you probably have heard that called ARPA. Those are the dollars that came post-COVID to help get things back on track. They're using that to stand up healthy aging programming in the counties. And the cool thing is it's going to go to the administrators of the counties. So the commissioners and the executives in Summit County and others will be able to help guide the program development, and area agencies are reaching out to make sure that the counties know that we're a resource for exploring different ways that the programming can be implemented to help people in most need. This is a really big win because it was actually cut from the budget, and then thanks to the advocacy around the state was put back in and made it through the process. So that's really good news. We also had an increase in up here it's called flexible state funds. And you've heard me refer to that as community service funds or block grants, but they don't use that word anymore. So I probably shouldn't either, but I'm an old dog. So we grew that, as you can see in both the 24 and 25, $500,000 and $1 million respectively. And a couple other earmarks there. Regarding the Department of Aging, the Ohio Department of Aging, a $2 million grant award for Alzheimer's and dementia, an economy report, technology investments, and some Benjamin Rose investments for their projects. And then here's the really great one. I'm very happy to show that we have moved the needle in paying people to help older adults, and wages have consistently been an issue. They were an issue before the pandemic. The pandemic did no favors to anyone in the service industry, but especially taking care of older adults became an even greater challenge. We are now looking at a $17 rate for home care in the first year and an increase to 18 in the second year. The catch is that while this passed through the budget, it was line item vetoed at the administrative level. So the governor line item vetoed this because they didn't want I might have the verbiage. Oh, I didn't. They didn't want the rates to be in statute for home care. And so the administration has said that they will honor the spirit of this. They just didn't want it in the budget bill per se. So we're really looking forward to how that's going to help increase the access that our older adults need to have to stay at home successfully. And also the MyCare Ohio expansion, there was a piece there about how the next version will look. MyCare Ohio is a demonstration that takes Medicare and Medicaid and puts them together to manage both if possible. The demonstration is set to end at the end of 2025. And so 2026 will bring a new version of the duals program. And we're happy to say that the state's already thinking about that, planning for that. And that in the budget, it was said that when the program goes statewide, it requires plans to use the area agencies on aging for waiver service coordination for the 60+ population, which is the same verbiage that we have currently. And so the state's really doing a nice job of maintaining consistency for people that want consistency in their care management and their waiver service coordination. Remember, these are folks that are living at home instead of a nursing home, saving the state money to where they want to be. And this is another way that they can get the care that they want in the place that they want to stay. And then finally, an additional $4 million a year for adult protective services. And so we hope that it seems like we make little incremental growth steps in APS, but several of us were in DC a couple months ago and had heard that APS is a priority and that it continues to be discussed. We heard that again at our annual conference a few weeks ago in Salt Lake City. So important program funding, hopefully will come to meet it. And this is a good start to that raise. So that is my brief, quick tour through the biennium budget as it relates to aging services and programs. And so I'll pause here to see if there's questions or comments. Yes, ma'am. So the ARPA grant is a huge, that huge pot of money that came from the federal government to multiple different areas. And so some state-based organizations got it, some local organizations got it, government organizations received it with a design towards getting the country back on track. Oh, so that is the Healthy Aging Grant that came out of the state budget. And that is right now moving through the Ohio Department of Aging to figure out kind of how the implementation is going to work. I was on a call this morning with the executive's office from Summit County, and they said that they plan on hearing more from the director soon about the Healthy Aging Grants and expecting a timeline. You're welcome. Jeannie? So if we're going from what to what, I don't know exactly where the average is for us right now. Do you know, Abby? I think it's, I was going to say 13. So I would say that this is a pretty significant rate. I don't know if anybody else has an idea of what the current home health rate is, but I can get you a more firmed up answer and see that it's put in the minutes. It is. So there are training requirements for home health. It's not the same as like a registered nurse or a licensure like that, but there are requirements. I don't think it's referred to as a license, but they're much like an STNA certification training. I know that there's providers in the room. I don't know if I'm saying it right or not, but if there's corrections, let me know. Yeah.
Is there any increases for Medicaid waiver?
Yes, so those rates are Medicaid waiver. Those are the rate increases for Medicaid waivers. So the home. So they're the no, that's okay. The $17 an hour and $18 an hour for the home health aides that are going into the home of Medicaid waiver recipients to be able to provide this. Assisted living did get an increase in the waiver. I'll have to look and see what that came out to be.
I also had a question about moving shared effort.
Yeah, that wasn't part of our kind of platform, and so I didn't have any updates on that. We focused really tightly on the budget results, so I don't have the information on that.
Any information that you could share with us?
Sure. Anything else? All right, well, thank you for your time and interrupting your lunch. Sorry about that. And I'll ask Courtney to come up and she can introduce our speakers.
Hey, good afternoon, everyone. Thanks for coming out. While I had the mic, I promised Lori that I would bring up the coupon books on the table. So when you leave today, feel free to grab a coupon book for Hartville. Big thanks to Mara from Hartville for providing those to us. And then we also have fall prevention guides and Getting Wiser magazines and adult coloring books out there. So feel free to grab any and hopefully all of that on your way out. But we will move right along. And I also remembered too, I know Melissa Long, our Portage VP, is not here, but when I spoke to her on the phone, she did mention the only update she had was to encourage everyone to check into issue 1 a little bit more for the upcoming August special election for that. So moving on to our last topic of the day here, we are thrilled to welcome 3 guest speakers with us this time for SNAP and Medicaid and public health emergency updates. We have Tammy Hickman from Portage County JFS. She's a supervisor there. Jennifer Mullally from Stark County JFS. She's the staff development manager. And then we also have Lena Huff, a program manager at Summit County JFS. So they'll come up and go through their updates, and then we'll take questions at the end from online and in the room.
Jeez, I apologize. Hi, everybody. It was a good lunch. Hope I'm not wearing it on my face right now. I'm a little bit smaller, so put that down here. As you all know, PHE is ended, as far as we know for now, hopefully forever. There have been quite a few changes, as most of you are aware of. The issues that we're encountering from it, I'm sure is across the board. But I'm getting reports from my workers that we're having difficulty getting clients to turn in renewal packets, redetermination packets. They haven't had to do it for what, 3 years? So, getting back into the swing of things, getting them back into the habit of turning stuff in. So we're just encouraging people, when you deal with anyone that's on assistance, to encourage them to return anything they get, or at least make a phone call to us. The other thing we're noticing, aside from the renewal packets, is resources. We're having trouble getting our clients to turn in any verifications that we ask for, especially resources. For SNAP, one of the things that has kind of made it easier, I don't know how it's going for other counties, but we don't have to do interviews now for redeterminations. That continues through February of 24. So they just send stuff back, we verify it, we don't have to do the interview, which cuts down on a lot of time. Unfortunately, we haven't seen that in our phone queues. We're still having quite a wait. Student exemptions, as I'm sure you've all heard, has ended. It's a little confusing. Some people are not quite sure why they're staying on, why they're not. The exemption continues for anyone that was approved prior to July of 2023. They stay on SNAP benefits until their next redetermination. If they applied and were approved July forward, the exemptions are in play. If there's a change that affects them, we can discontinue. But if they were approved prior to July of this year, they're going to rock on until their next redetermination date. So I know a lot of people were confused about that. Kent State always has a lot of questions. A big change for us is we are no longer in the shared services group. We are taking calls just for Portage County. We thought we would see a huge decrease in our queue wait. Unfortunately, that hasn't happened because of everything with post-PHE. A lot of people have questions. The biggest thing we're seeing is people that haven't been discontinued. No one was discontinued from Medicaid for years. And maybe they had some income or resources changes in the last year or two and they weren't eligible, but we were still under the PHE guidelines, so we couldn't discontinue them. Now we're able to discontinue, and we're discontinuing people and they don't understand because nothing's changed in a year. Why are you discontinuing me now? And it's very hard, for them to understand that, and we do our best, but it's confusing to us too. We were hoping that with the new PCGI system. I don't know if anybody is aware of it besides the county workers, but it helps with resources. It's supposed to help us speed along renewals. We just had a new training this morning that we're still deciphering, but it looks like we will be able to do more with Medicaid, getting people approved quicker without having to make as much contact with them. So hopefully that's going to help out with the people that got in, into the rhythm of not having to turn stuff in. Overall, with the changes, our calls have increased drastically. So our county has about a 1 to 2 hour wait. And that's not, I want to clarify that's not on our long-term care line. So specifically for long-term care, we are not on the toll-free number. We still use our direct phone number for the county. So if anybody's calling Portage County, you'd call our 297-3750 number, follow the prompts, and you'll get one of my incredible workers directly. So if anything, we have maybe a 10-minute wait on that line. So that's hopeful. But for the people calling the main line, there's a bit of a wait. We do try to encourage people that are dealing with anyone that's on long-term care to not call that shared service line, to call our county directly. And if anybody needs that information, I'm happy to give it to you, our direct phone number with the actual prompts, because if you're like me, you're just yelling representative into phone or pressing 0 100 times. So I can give you the exact prompts so they don't have to wait through anything. They can push the buttons and get there. But we attribute the long calls on our case bank line because of the student exemptions ending and backlog of documents and applications. And this is a catch-22 for us because we can't process the paperwork when we have so many calls, and we get more phone calls the farther we get behind on paperwork. So kind of a vicious circle. And there has also been a new form introduced to us for the state for work participation. It's a new 7-page questionnaire that we ask when people are applying for SNAP benefits. That has also taken more phone time. So again, we're working out the bugs, and we're still trying to give great customer service, but LTC, if you're calling Portage County, make sure they're calling our line directly. They won't have to wait. That's all I have for Portage. Thank you.
Good afternoon. I am from Stark County. A lot of the things that I have on my list, Tammy's already spoke about. It's very similar from county to county, what we go through. As she said, for our Medicaid renewals, we are also experiencing the same thing. Our customers are not returning those packets to us. So unfortunately, we are terminating their benefits, which causes more phone calls to come in. The state has made a lot of moves trying to get automated services for us, trying to get them to passively renew, basically so we don't have to touch any of those cases, that they just are approved and the customers never hear from us. They just continue to receive their Medicaid. So that's a good thing. Unfortunately, it doesn't happen for everyone. So in those situations, we do need to make contact with our customers. When we do terminate someone, we have brought back our pre-termination review. So we're still looking at every possible program that someone could be eligible for. So someone that maybe has a persistent mental health issue or a persistent physical health issue, there are other programs that we will look at before we terminate their benefits. Also a 90-day reinstatement. That's something we haven't done for a while because we haven't closed anyone. So if a customer fails to return their renewal packet to us timely, they still potentially can get their Medicaid open back up without having to go through the whole reapplication process again and verify everything to us. For the SNAP side of things, for food assistance, we're also part of the waiver where individuals do not have to complete an interactive interview in order to continue their benefits. And that will continue until February for us also. A lot of our elderly folks, they still like to call us though. Sometimes that's the only interaction they have with anyone all day long. So we still encourage them to call us. One of our workers will certainly help them and they'll get their food stamps renewed for them. One thing that we've seen with the end of the PHE is for 3 years, we were issuing maximum allotments to our households. So if it was a household of one, everyone was receiving $281. Now that the public health emergency has ended, back in February, we actually stopped doing that. So a lot of our families, individuals, single people, they're receiving the minimum of $23 now. So that's been a huge learning curve for them. Why did they get $281 and now they're getting $23? So when they call us, we still go through their income. We make sure they're getting all the allowable deductions, and then we refer them to food banks. Now that's probably the number one thing that we're utilizing in Stark County is our food banks. Tammy already spoke about our new 8-page form that we get to do with everyone. So that is definitely changing our call times. We are on the phone with our customers a little bit longer. Also with food stamps, there has been a huge upswing in fraud. There's skimming. Electronic benefits are being stolen. This started back in October of 22 is when it really started to hit. Customers received their monthly allotment, and as soon as they received it, it was gone. So there are scammers out there that are able to come through and take all their benefits off their cards. So we really caution change their PIN numbers frequently. If they do experience a time when their benefits are stolen, they need to immediately request a new food stamp card. The state has just recently started to reissue those benefits. So if you know of anyone that has experienced it, they need to call their county. We can get them the form and potentially we'll give them back those benefits. Let's see what else. As far as just some agency updates, our phone wait times are, I wish I could say 2 hours. Sometimes we're upward of 5 hours. So we're in a perpetual hire and train mode, trying to get more individuals in. I actually have 9 new staff starting in a week. So we're really hopeful that that'll make an impact for our customers. I would recommend that anyone that does need to call us, that they call us early. Usually about 10:30 is when our phones really start to pick up and those queues get backed up. There is a new feature with our phones. We have an automatic callback. So customers can enter a queue and we will actually call them back when they come up to be talking to someone. So they don't necessarily have to stay on the phone for 3-4 hours. We will give them a call back. In our agency, we have a lot of changes going on, which is exciting for us. We have a new executive director. Jerry Coleman is our new director. So we're looking forward to kind of moving into the future with him. We have just embarked on a 12-month training focusing on our customers and rewriting our vision and our mission statements. So we can kind of get back to what the customers mean to us and how we can focus on giving them the best experience possible. So does anybody have any questions for Stark County? All right. Thank you.
Hello, I'm Lena Hubb from Summit County. I almost forgot where I'm from. So thank you for having us out to hopefully we can answer some questions and again, a lot of our information is the same from county to county. We're a larger county, and so, when Jen's talking about some of these wait times and things for the phone, we experience that also. We do not have a 5-hour wait. I'm sorry, that's stressful, but we, at times have had a 3, but we've definitely come down from there. I would probably say hour and a half. I'm probably being a little optimistic, but we're about there. Since a lot of this is covered with, Tammy and Jen, it'll give me an opportunity to brag on our county a little bit. What we have with the SNAP allotments that Jen was talking about, we're getting the max allotment, and once the PHE ended, people went back to their regular, what they were eligible for based on their household size or assistance group size rather. So we partnered with the Akron Canton Regional Food Bank to do some pop-up food distributions. So we used our TANF dollars. And so for 3 months, we did pop-up locations and handed out a box of produce and then some staples. And it actually went very well. We served a lot of families that way. Another thing that Summit County is doing is, and I brought these flyers too, we're really pushing it's the fruits, I'm sorry, $25 towards fruits and vegetables. So we push out a robocall with some of the farmers markets, and there's a few grocery stores that are participating in this program. And so when our clients spend $25 on produce, they get matched another $25. So it's really pushing that out there, getting some fruits and vegetables, fresh fruits and vegetables on the tables. Oh, and this area I'm over, we have expanded our outreach area to kind of meet people where they're at. I liked hearing you guys talk about the libraries. That's new for us. We started putting a case manager. We started off with 4 libraries. It was North Akron, we did Vernon Odom, Lakemore, Springfield Library, and Highland Square. So just some libraries in the community, and having a case manager out there once a month to people can come and they'll look at all benefits, they can apply, they can just answer questions, they can turn in verifications. So now that has actually grown. We're now at 6, including the main library, and I think Maple Valley is we're adding. And it's brought in a couple independent libraries as well. We're now at Stowe and Twinsburg, which is exciting for us because Twinsburg clients have a hard time getting to our offices, and to have somebody in their community meeting them where they're at. They love it. So it's turning out to be a very successful program. And I also have a flyer for that has the days that we're at locations and what locations we're at. So it's good information to have. What else we are doing is with United Way, we've partnered with to get our case managers in our schools. So at what do they call those? The family resource centers. And so we have case managers at Robinson, North High, Mickey Bright, Vernon Odom, and higher. So when people are, anybody can come to those locations, but we're finding it very helpful for parents dropping off their kids. They can come in and update their cases. They can apply. They can get any questions, turn in verifications. So it's been very, very helpful. So they're there once a week, even through the summer. And let me see. So another thing, knowing that the phones are very difficult to get through, we also put this out at all our outreach locations, all the ways they can contact us, our email, our fax, everything that we have, different phone numbers for different areas. And we're just putting these everywhere. So people have another avenue just than the phone. So those are the things that I'm super proud of our county. As far as everything else, we're pretty much the same. We're in the Medicaid boat trying to dig out of there, but this has been very helpful because people with their benefits ending and we're out in their communities, we can help them. So any questions? And have all those flyers if anybody wants any of those. Yes. Yeah. Oh, absolutely. Yeah. I'll get your information. I'll give you my card. Yeah, absolutely. Anyone else? Yes.
I am wondering what direction home or other organizations can do to help you with access and issues for older adults that are and
Yeah.
is there anything that we can do, and this is for all the speakers. I'm thinking of our Aging and Disability Resource Center. We're kind of a targeted 211 for older adults, and so I wonder if there might be a kind of formal connection between us and JFS if someone has lost their benefits and needed to see if there's anything.
We are
else.
definitely open to that. We have had, these are just places that we've added recently. We have people at the hospitals. People, if they come in without insurance or their insurance is not closed, we can help them apply. So I know Kathy's groups, they have people at the nursing homes. I just spoke actually at one of the elderly apartment communities. So just went in and answered general questions, and long-term care was there also, just answering some of those with assisted living and waiver services. And we let anybody know, like, we're willing to come out, answer some questions. And then, but I can also give you my card because we can talk about maybe doing something with Direction Home and seeing what the need is and see what we can do. We're always open to that.
One thing I'll bring up, and then
Excuse me, sorry.
had a really great, Direction Home staff had a really great meeting with the Akron Food Bank this week. And they let us know that they have a few more grocery boxes that they put together monthly that they can give out. So that might be a connection too. I'm not sure if you have like a formal connection between the Akron Food Bank and folks that are calling and maybe have had their benefits stopped or reduced to access food. That might be something that we could create kind of a throughput so that there would be some sort of a standard work connection between the older adults calling for food assistance and access to those boxes. There, of course, there's to kind of accessing that food, but there are multiple locations throughout at least our 4 counties. It's actually a larger footprint that they have, but they do have additional boxes that they can give out. So
I believe that the food bank, they do 1 to 2 food distributions a month, I believe, and I think you just have to give your driver's license, like kind of what county you're in, but they make it very easy. You can drive through, they'll load the stuff in your cart, and that's when we did the pop-up with our TANF dollars to give them money so we could have extra boxes, getting out. So we did that for 3 months and it was really successful. So, yeah. Anything else? All right. Well, thank you so much.
Any last questions from anyone for any of our panelists? Okay, when I got up here, I didn't see anything from online, so I think we're from there.
I know it's extremely difficult to guys do every day, and particularly with staffing and the angst that you get on the other side of the phone. So thank you very much for what you do and what you staff to do. It's so difficult. Thank you.
I think that's all. I'll turn it over to Lori to close this out, but feel free to stick around. I know I wrote this for 1:30. That was part of the plan. We could talk, and so I know it's been a while since we've seen each other and been able to gather and pursue everything. So feel free to stick around. We have the room, and we have boxes to leave them. And I think that's it for me.
Thanks, Courtney. Thanks for the great news, by the way, Budget Man. That's great stuff. I mean, we don't usually get good news, no offense, Matt, but we don't usually get good news like that. That's really cool. That's really awesome. And the outreach and the collaboration, I love the outreach to the libraries. And I mean, that is so cool. That's just like a resource that everybody goes to. And what a neat thing.
We partner with them, all of them counties. They can go into anybody there, and they will get help from the library staff with running verifications to us. They will also help them apply and get some more. They'll get it to our that's at any other.
Great.
With that, they're on the bus. Yes, they are.
And I want to echo too, thanks you guys for what you do and your staff, because my gosh, that's the volumes as we kind of talked about is crazy. Just the needs out there. So thank you. Thank you all very much for taking the time to come to today. Anybody else have anything for the good of the order? Okay, cool. Thanks for lunch. Courtney, thank you for coordinating and keeping us organized. Yes.
The next meeting is simply here or in the new building?
Virtual.
Oh, and then
Yeah.
So next meeting is going to be virtual, so everybody knows. Thanks. Okay, great. So I move that we close the, gosh, this is July, sorry, I think for a minute where we were. Area-wide advisory council meeting. Do I? Thank you. All right, thanks, everybody.